आपणक स्वास्थ्य आम दायित्व चिकित्सा भित्तिक कार्यक्रम द डॉक्टर्स केवल HM वेब टीवी रे।
Hello everyone, I am Dr. Sunita Mishra, Professor of Obs and Gynae in High-Tech Medical College and Hospital, Bhubaneswar. Today I am going to share some information on PCOS. The full form of it is Polycystic Ovarian Syndrome. It is one of the commonest metabolic and hormonal disorder that affects many women of reproductive age group in all the age group. So it can affect the adolescents and also all the females up to menopause. So what exactly is PCOS? So PCOS means it's a hormonal disorder where the ovaries are enlarged with multiple cysts arranged around the periphery. Now, what causes this PCOS? So, there are many other factors. So, mostly it is either due to genetic factors or because of environmental factors, lifestyle modification, from changing from active lifestyle to sedentary lifestyle, then changes in dietary modifications. So, these things can usually cause PCOS, and the most important factor is obesity. Obesity can lead to PCOS. PCOS can cause obesity, as well as obesity is an important causative factor for PCOS. Now coming to the diagnosis. Now how will we diagnose PCOS? So usually the patients, they present with delayed and irregular cycles, and some present with very scanty flow. And adolescent females, they usually present with these delayed and irregular cycles. Along with that, they present with acne and excessive body hair. So in the facial hair is increased, or there is excessive hair in other body parts. And along with that, obesity, recent gain in weight is there, then change in lifestyle is there. So those things, and other women of reproductive age group, they present with fertility problem. They have infertility problem. They have difficulty in conceiving. Okay, so this is how you will diagnose, and then there are certain other you can diagnose by biochemical and clinical markers also. So you will send some investigations, lab investigations, we'll like to do some hormonal tests, LH, FSH, then thyroid profile, then prolactin, then fasting serum insulin, blood sugar level, and testosterone levels to diagnose all this. And most importantly, we confirm our diagnosis by doing ultrasonography. Ultrasonography will show enlarged ovaries with multiple small cysts arranged around the periphery of the ovary. Then what are the consequences of this polycystic ovarian syndrome? So what happens is, if you leave it untreated, so it's not a big deal, but it can cause delayed complications. So it can lead to development of type 2 diabetes mellitus, or it can lead to development of hypertension, and also it can cause cardiovascular symptoms like coronary artery disease also, dyslipidemia, there is derangement in lipid profiles. So all this thing can be treated. It is correctable. It's not that it's not going to be treated. It can be correctable. So how can you treat? So treatment is again individualized. So every patient has different treatment protocols. So a young female, like an adolescent girl, she's coming to you. So we have to counsel them that this is nothing, it's not a big deal, and exercise and weight reduction, that we have to counsel them, and then we can go for cycle regulation in these adolescent girls with COC, cyclical oral contraceptive pills. Then suppose a female who is newly married, and she's having delayed and irregular cycles, but she doesn't want to plan for pregnancy. In those cases also, we can just counsel them, and we can give them hormonal treatments like oral contraceptive pills for cycle regulation. Then some other females, those who want conception, those who are keen for having babies. So in those patients, we can go for ovulation induction and other medications after correcting the cycles by OC pills. Then there are other females who have completed the families, and they are dealing with obesity or something. So in those patients, very obese patients, we can advise for bariatric surgery. But most importantly, we can advise them for lifestyle modification. Lifestyle modification from sedentary lifestyle to active lifestyle, and then exercise and weight reduction. This is very important. So to conclude, PCOS is no doubt upcoming and very rampantly seen nowadays in many of women, but it is treatable and it is correctable. Thank you.
आपणक स्वास्थ्य आम दायित्व चिकित्सा भित्तिक कार्यक्रम द डॉक्टर्स केवल HM वेब टीवी रे।